Hi, everyone. The COVID-19 pandemic has now physically affected more than 3,400 people in Windsor, Essex, and more than 60 million people worldwide. And I think it's safe to say that mentally, it has touched us all. And that is what we're talking about today. Hi, everyone, and thanks for joining this Facebook Live broadcast. I'm Allison Johnson at Windsor Regional Hospital with a great panel of guests here today. We're going to talk about the effect COVID-19 is having on our mental health. What is normal, when to seek help, and where to find it. So please join me in welcoming our guest today. We have June Muir. She's the CEO at the Unemployed Help Center in Windsor and one of the first people in our region to test positive for COVID-19. We also have Jonathan Foster, VP of Emergency and Mental Health at Windsor Regional Hospital, and Evelina Horohovic, mental health educator with the regional branch of the Canadian Mental Health Association. Hello, everyone.
Hello, Allison.
Hello. Thank you all for joining us today. Whether you have the virus, you're caring for a loved one during these unprecedented times, or you're just trying to survive in the new normal, we hope that everyone joining this conversation will find some value today. And if you have a question for our panelists throughout the day, please post them in the comment section below, and we will do our best to answer them during this broadcast. Before we begin, though, I do want to mention that if you are experiencing a mental health emergency, don't wait to get help. Please call 911, visit your emergency department, or reach out to an emergency crisis line. And we have posted this information in the comment section below, so it's available. So we're going to start. First question today goes to June Muir. And I mentioned last week, the reason that we're doing these conversations. Having gone through it, she felt that it was important to talk about the effects, the impact that COVID-19 is having. And June, last week, you very generously shared your story about the physical impact of COVID-19, both you and your husband sick back in March. How did the emotional toll compare to the physical?
It took a toll on me. I was devastated, and it emotionally affected me that I was diagnosed with COVID. That in itself is a lot. And I was struggling with the fact that I had COVID, not knowing what was going to happen next was a huge struggle. I also struggled with the fact that when it was time that I knew I was okay to go back out into the public, when I was cleared by a doctor, I was still afraid that I was contagious, and I was afraid to see my family. So I struggled, Bill struggled. Emotionally, having COVID plays a heavy part on your heart, obviously. So I definitely struggled through COVID and still do today. Very afraid that I'll catch it again.
So many different areas that can impact our mental health here. And again, I think it goes back to what we talked about last week, that fear of the unknown. I want to ask Jonathan a question. This is a pretty broad question. Is it possible to sum up the mental health toll that this pandemic is taking on us individually and collectively?
So it is a broad question, but it's a broad issue. And I think we can break it down into chunks. In the first case, everybody's mental health has been impacted by COVID-19 and the pandemic. Everything that we're used to in our day-to-day life has been turned upside down, and the things that we're used to doing to keep us anchored, to keep us coping well. And in many ways, those have either been changed dramatically or in social cases eliminated from us. So everybody has had stress levels that they've never experienced before. And then there are the instrumental impacts of the pandemic, the people who have not been able to work, have experienced economic hardship, who have been really separated from key family members. That's been a stressor. People who have never experienced troubles with mental health or addictions in the past are now experiencing them for the first time in the context of the stress of the pandemic and the fear that goes along with COVID. And I think June talked about that fear, and fear has been a big component of this. The second wave of impact from the pandemic is on people who have been living with mental health or addictions struggles throughout their life, or chronically, or in the last little while. All of these stressors impact those types of conditions doubly. And the third impact has been a real struggle then to, in some parts of the pandemic, to access programs and services and primary care in the same way that we did before, due to the restrictions that were put into place, or the availability of some of those services to provide face-to-face services. So kind of think about it in those three chunks.
And that's why conversations like this are so important. And I really do appreciate our guests for joining us today. And a reminder, if you've got questions out there, this is a great opportunity to ask. To Evelina, a question. At the start of the pandemic, a Mental Health and Addictions Urgent Care Center was created. And this was a partnership between the Canadian Mental Health Association and Hotel Dieu Grace Healthcare. What have you been seeing at the center?
So at the center, we have some statistics. Over a 100-day period, we had 355 visits, mostly mental health related, but also related to addiction services, psychiatric consults, or primary care. When we talk about primary care, 30% of our visitors didn't have a GP or an NP, so and 85% of our visitors did not have a psychiatrist. So the presenting issues that we've been seeing is 65% presented with anxiety, 45% presented with depression, and 19% presented with substance misuse. So we also had symptoms of serious mental illness, suicidal ideation and thoughts, or threat to self or others. So what we do is, and the visits are on average an hour and a half long, and the individuals are either booked for a follow-up at the center, or they're referred to a community service. Sometimes they're taught self-strategies to managing symptoms, or sometimes they require an emergency department visit because it's such an urgent issue that is the intervention that is needed.
And we're going to talk a little bit more when it's needed to seek help, some of those strategies. But I do want to talk a bit more first about the patient perspective. So last week after we had our conversation, one of my colleagues reached out, and he felt that this was such an important conversation to have that he wanted to share his story of coping with COVID. His name is Paul Dunn, and here is his story.
My wife and I both contracted COVID early in April, Good Friday weekend. We'd both be considered long haulers, as we both were sick for months. We neither one of us got our second or back-to-back negative result until late in June. We had all the symptoms. We had the high fever, like really high. I was worried that my fever could be that high, but it would break and come back. Respiratory problems, I had them pretty bad enough that if I was single, I would have came into the hospital, but I just didn't want to abandon my wife. She had respiratory too, not as bad as me, but we had serious fatigue, serious headaches. But one of the things I want to talk about was that for me, I came down with like bad, severe anxiety, bad enough that I needed to call my doctor and have him send me some medication. I have a good doctor, so I've been with him for years, and he was like, "No problem, I'll send it over." And even still, I struggled, and the anxiety I'm not talking about being nervous or anxious. I'm talking like physical symptoms, like my heart was racing and I couldn't sleep and just couldn't get comfortable. And part of it was when you're laying down and you can't breathe properly. I mean, to me, always, if I ever experienced anxiety in my life, it's always been centered around breathing. And for me, the anxiety was probably one of the worst symptoms that I had. And it's tough. I mean, you turn on the news, everything you heard was negative. Everything was negative. There was hardly anything to be positive. And at first it was interesting to listen, and you want to get as much information as you can. And then eventually it was like, I can't do this no more. I can't watch it. It's just feeding this anxiety. I'm home with a big black lab that I love, my buddy Bear, and I got a cat. And they're both laying on me all the time and snuggling with me like crazy. And then the news is telling me, be careful, you can give your cat or dog COVID. I was like, oh my God, I can't take this no more. So, eventually we got on the other side of things, and for me, thank God, I don't deal with anxiety. It's gone. It was just present during COVID, and it's a serious. I mean, that's another element of COVID that people have to deal with. We didn't have to worry too much about the financial part. I mean, I can only imagine what the people that have that going on at the same time. That would only add to it. I didn't have that, thank God, and so. But still, it was horrible. And so I didn't get any long-term effects of it that I know of. But I mean, I still have the brain fog, and I don't know if that's mental. It still exists. I will forget things mid-sentence. So there's a lot for people to learn. I mean, I'm aware now that, there's things I still think about and worry about, but I don't have anxiety over it. Like, will I catch it again? And if I do, will it be worse? Or is the vaccine going to be safe? But I can't control those things. And without the looming, lingering COVID threat, I don't have anxiety at all anymore. So thank you.
And that was Paul Dunn. Thanks, Paul, for sharing your story. And one of the reasons that we're doing this is to give people hear different voices and know that some of that stuff that you're feeling, is not, you're not alone in those feelings. June, when you were listening to that, did anything sound familiar?
Absolutely everything, Allison. The only thing different is that I still today have anxiety. I listen to the news and I have anxiety that, will I be a long hauler forever? And that does still really sit heavy on my shoulders because I still have brain fog. I still have anxiety. I still, have, times where I have the palpitations. So there's no answers as to, will this last forever? So it really plays on me. And, but I could really, really appreciate where Paul was coming from. Absolutely.
And Jonathan, Paul mentioned having to call the doctor and having to ask for something to help him cope with the anxiety that he was feeling. When is the right time to seek help?
The best message that I can give is don't wait, don't delay. Reach out the minute you start to feel like you're having some distress, depression, anxiety. You have to remember, depression and anxiety are emotions that we're all supposed to feel some of the time. The good barometer to think about when am I starting to get into trouble is when the feelings are persistent. They're stronger than they normally are. They won't go away even with your usual coping strategies. And they're starting to interfere with you being able to function with your family, at work, at school, academically, to the extent that we're involved in those things right now. And primary care and your family doctor or nurse practitioner is one of the best places to start with. They're very experienced in talking. A good portion of primary care is about talking about mental health. It's intrinsic with your physical health. And in Paul's experience is a good example because he was able to reach out and get something that was helpful right away. The second part to couple with that is to talk to somebody through counseling. Counseling and medications are the first go-tos when you truly are struggling, and people can make choices about what the right treatment option is for them after they talk to those professionals that can help guide them to help understand what the best course is for them. But the bottom line is don't delay, especially right now. We have to be taking more care of ourselves than we normally would because we're in such extraordinary circumstances and each other.
Good advice. And Evelina, I want to ask you, do you have any resources? We mentioned off the top, we have posted some resources if anybody is in need right now. Anything additional people can reach out to in the community?
One of the things I think is important for resources and just learning about the fact that so many people that have never been affected by these kind of issues are now being affected. So basically having these conversations, normalizing these things and learning more about, what anxiety looks like, learning more, maybe using a measure to see where you're at, what level you're at. And there are online resources that anyone can access at any time. The government has invested in one that's called Wellness Together Canada. It provides a lot of information of how somebody may be impacted. There's self-guided mental health care supports. CAMH does an online peer-to-peer discussion forum. So I think in talking to someone else who's experienced something similar is very helpful. So, it can be very isolating and lonely to feel like you're the only person who could potentially be experiencing what you're experiencing. So going on to, for example, the peer-to-peer forum, Together All, going there, making an account, sharing your story, getting feedback, connecting with other people in those mediums. There's also Bounce Back Ontario, which is a free cognitive behavioral therapy skills program, where if you're struggling with finding ways to sleep better or deal with symptoms, that could be helpful as well. But if you're ever unsure about what community resources are available, call 211. Ask, hey, I'm dealing with this. I'm just calling because I want to know what's available. Can you please help me? But there's a lot of information on the public health unit's website, on our website. Please don't be afraid to start exploring and just learning more and trying something, because that's the first step right towards wellness and trying to get back to some sort of normalcy if possible.
Right. 211, some great advice there. And we also posted some additional links to the Canadian Mental Health that is posted on your website. So if anyone is looking for some of these resources and additional resources, you can find that in the comments section below. I want to add another group to this conversation and talk about the stress that this is having on caregivers. And I do want to introduce you right now to Heidi Robertson, whose husband, Tori, is a nurse in Michigan. And he spent 5.5 months, so 173 days in the hospital as a patient recovering from this virus. Here's her story.
I went in the ER March 30th, and I said bye through the plastic. It was all closed off. It reminded me of ET when they went in. And so I said bye to him through the plastic clear spot on the window. And then I was not able to visit him until May 30th. So 2 full months. And it was really, really bad. I felt like I was I didn't even feel it was just surreal and so scary. And I don't know, it's just so many things that go through your head. And because the whole world was on lockdown, it was weird being at home. And I mean, some days days would go by, I didn't even change my clothes. And I would always just look for updates from the hospital. And I prayed a lot. When he was moved to the 7th floor, I just was so he was alive. And it just, because he was so near death, it was just so scary. And not being able to go to the hospital, it just such an unusual feeling. I can't explain it. Some days were very, very dark. Some days I cried so much I couldn't even think straight. I just couldn't believe it was happening to us. And I felt so bad for him, him being out of it and on all those drugs that kept him sedated while he was on the ventilator. And I couldn't think of anything else. That's all I thought about 24 hours a day, very hard to sleep. And I'd wake up in the morning at 5 or 6 in the morning. And first thing I would do was call the hospital, to see how his night was. I would stay up late, call before I went to bed. So it was, very helpless. One doctor said to me, I want you to prepare for the worst. So a lot of times when I would first visit him in the hospital, he probably didn't even know I was there because he was sleeping most of the time. But I've been every single day that I could. Yeah, when he was in the hospital, I went every day. And the nurses were really good, and the doctors, and they would update me. And, as the days and weeks would progress on, he would become more alert. I was just so happy that he was coming home. And it was such a long 173 days. And I don't know, the nurses and doctors and therapists literally became our family. We have pictures with them, and they're all so good to him and good to me, and they're just really good people. And I was just so happy and so grateful for all of them because they really took Tori's care very seriously, and they're all amazing.
So thank you for sharing your story, Heidi. I know a lot of people at home probably feeling similar right now. And to Evelyn and Jonathan, she mentions feeling very dark, not being able to change her clothes, crying, not being able to get out of bed, feeling helpless. And I know that many others can relate to this. Let's talk about some strategies. She did mention that she prayed a lot to get through this time. What else can people do who are having similar feelings? Evelina, let's start with you.
Absolutely. It's obviously very difficult to deal with any sort of family member or somebody really close to us, and especially not being able to visit them, see them. It's a hard thing to deal with, and just sometimes experiencing those feelings and acknowledging them and being self-aware is hard when we're struggling. So sometimes we don't have insight that we're really struggling until later we look back and we're like, wow, I was having a really hard time. So oftentimes those people around us will really let us know if something's going on because they'll notice it before we do. So really trying to be connected to loved ones, people around us as much as possible, whether that's just checking in with them, being honest about what's going on, and seeking that support, and knowing that you're not a burden, you're not alone. You can talk to people, talk to a trusted person who can be there for you, and allow yourself to do that, because that's very important. That people are really feeling disconnected, and especially if you're going through more challenges, you're going through mourning of and grief of change in life. So you may be experiencing those things of anger and sadness and frustration and loneliness, and feeling like you're really having a challenging time, and it's okay. And just talking about it with someone is the first thing you could really do. And yeah, you'll have bad days, you'll have good days, but knowing that it's not permanent, knowing that, yeah, you may be having a bad day, but try not to negative self-talk and make yourself feel worse. Try to do something kind for yourself, or reach out for help. That's what I would suggest. And I think a lot of people have that experience, especially if a loved one is going through a health issue.
And it's so important that social support, those social connections, like you said, we feel like we're getting less and less of those, even though, and we're online all the time, but it's not quite the same. Jonathan, in terms of that social support, what can we do? What advice do you have for people who are in this situation?
So just to touch to an extent on what Evelina talked about, there's two big factors that I think are preying on us all right now. And the first is hopelessness, and then the second is fear, and they're obviously interrelated. The challenge with what we're going through right now is the hopelessness is a little bit insidious. This has now been going on for months and months, and we don't really see a good end in sight. And that's, I think, where hopelessness really starts to set in. And that's where, to use those terms of being dark, that's what really spurs that. So when we think about coping and think about using social supports, one of the things that came my way through all of this journey that I found incredibly helpful is the concept of a mindset and a thriver's mindset. And to me, that links strongly to the concept of resilience. And right now, I think if I have any advice on how to cope through this, and I have to take my own good advice some days, is to cultivate that resilience within us. And there's a couple ways we can do that. We can talk about that. But with respect to connecting to others, that's one of the ways that we stay resilient, because we are able to talk to people, share our emotions, get ideas and good things. Technology can work both ways for us. On one hand, we're probably more connected than we were with respect to the amount of time that we are using FaceTime and Zoom or phone calls and that sort of thing. But it's how we're using it that I think is key. And when we're using social support, we've got to use our support wisely. If we feel like venting, we should vent, but we shouldn't use that opportunity to connect with somebody only for venting. If you think about like an 80-20 rule, so 20% of the time venting and talking about how bad your experience has been, but spending the rest of the time really talking about it in a constructive way, making plans, having ideas about how we can do things differently during this time that are going to be better for people. That's kind of my advice around the social support.
That's some great advice there. And I know one of the things that's challenging is we have these necessary visitor restrictions in place at the hospital. We have had different varying degrees throughout the pandemic, and people aren't allowed to be at the bedside. And that is tough. It's tough when people are isolating at home and you can't go and help them there. We have a comment from Dave Flynn who says, "My dad passed away by himself in April of this year. Regret not being able to be there for him and can't forgive myself for not being able to be by his side when he dies." That is tough. And I know that healthcare workers here in the hospital are doing what they can. Can you talk about some ways that we're using iPads and helping to make those connections in these tough times, again, with these necessary restrictions to keep people safe?
Yeah, and just with respect to Dave's comment, I really, my heart goes out to you, and I'm so sorry for your loss. We've all, I think, been touched by that at some point, and again, it speaks to the pain of this pandemic, how something like death and dying and the grief that we go through has been completely changed. And just my thought to you on this is, in terms of forgiving yourself, we have to remember what we can control and what we can't control. And we haven't been able to control the pandemic, the rules that come down with respect to the pandemic. All we can control is how we're working through them and supporting each other through them. And we've been fairly creative in a lot of ways with that. To your point, Allison, what we have seen is people are as they die in hospital with their loved ones through an iPad. And I never thought I'd see the day in healthcare that we would be doing that. And it certainly doesn't substitute the physical contact and being able to hold somebody's hand. But it's let people be together in that moment in the best way that we can right now through something that we can choose.
And I do want to mention the Erie St. Clair Regional Cancer Program is hosting a free webinar tomorrow on this topic. Really tough for people who are in this situation, but they have some good advice. The webinar is called Beyond the Bubble, Caregiving from Afar. We're going to post some information about how to sign up for that if you're interested. You'll learn more about how to improve communication when you're caring for someone from a distance, how to work with care teams, and again, how to access these community supports. June, next question to you. How did you work with your family to make those connections when, that door was closed and they couldn't come in and help you?
So I had a lot of visitors at the window, and that's what kept me going. I had family and friends show up with food. I have a great big front window, thank goodness. And we had conversations through the window. I spent Easter with all the grandchildren and all the family coming for a visit. And I spent Mother's Day looking through the window at everyone, but it worked and it did help. And I also took a lot of walks when I could. When I could finally go out, how I dealt with my stress was I went walking. And the good news is you can walk no matter if you're in, a green, a red, a gray. I'm not too sure about a gray zone, but anyways, I was able to walk and I was able to deal with my stress that way, and it really did help me.
Being physical, I think, often helps. Another question, June, from Rona War. She wants to know, how did people at your work react to you when you returned, and how did that feel?
So that's a good question. What happened was I was sitting at home working on my computer. And Bill, my husband, said, "It's time you go to the office. You're fine. You've been cleared by the doctor. You're sitting here. You need to get back to work." So 3 months later, I just got up from that dining room table and I just showed up, not knowing what to expect, very, very anxious, stressed out about it. And I have to tell you, my work family here was absolutely incredible. So I think back to that day and I can't thank them enough for greeting me the way I was greeted. So it just made me feel that much more comfortable to be here. And then it led to feeling more comfortable to see others. So I just want people to know I was very anxious about it. It took me a while. When I got that clearance from the doctor that I could go out, I didn't immediately go out because it mentally played a part emotionally and mentally. Am I going to give this virus? Am I still contagious when I wasn't? So I'm glad that you asked that question, Rona, because I think many people can learn from it. Maybe they felt the same way.
Yeah, Rona, thanks for the question. June, I want to get back to your curious about the patient perspective, but you also have a role in the community at the Unemployed Help Center, and I'm sure you must be seeing some of this additional stress and anxiety in your role there. Can you talk a bit about that?
Absolutely. So we have 26 programs and services. We have essential staff here that are concerned, just as you have at your location. So we all talk about it together. We work together. We try and be as safe as we can be, but we're all very stressed and we're all very anxious because we're in a situation where we don't know if one of us is going to get it. We're all washing our hands, taking care of ourselves. But still, it is very stressful, and the staff is anxious. Now, if you're in a position where you can work from home, our staff is working from home. If you're not needed at the office, we have you set up. We have the capacity to set up people working from home. So that's great news. But there are a lot of people that are still working here, and we get through our days together. We're like a family. So definitely helps.
And we've read about the increase in substance abuse since the start of the pandemic. Evelina, what are we seeing locally?
Well, locally and in general, based on, I don't have a lot of local statistics, but we are seeing individuals coming in through the Mental Health and Urgent Care Center for substance. And like I said, 19% of the 355 visitors came because of substance abuse and needing to talk to someone about that. So it's definitely an issue. I know the House of Suffer scene, which does addiction treatment. They focused on women before. Now they opened up a men's virtual program. So there definitely is a need, and I know they're definitely busy. And I think everyone is trying to do the best they can to support individuals who do reach out. And even Wellness Together Canada, they have addiction support as well. So from the statistics from the Center for Addiction and Mental Health, it shows that there has been an increase in substance use, and especially alcohol and tobacco and cannabis use. We know that individuals who are staying home, like mothers who are taking care of their children, also have an increased amount of use based on the surveys they've done. Sometimes it's in the background and sometimes we don't always see it because it's not like people are going out to seek supports or help in our community settings, but we definitely know based on surveys that there has been an increase in use.
Jonathan, is there anything that you want to add to that?
Just that I think Evelina summed it up well. You've got to remember when we're feeling distressed, if we're feeling terribly anxious or sad, sometimes that's the accessible coping strategy that people pick. And when we start to use that as our primary coping strategy, that's when we start to run into troubles. And then again, we've got a lot of people in our community who have had chronic struggles with addictions as a disease. And this pandemic has made it so much more difficult for all of us to cope. But people who are experiencing more vulnerabilities, that population has been disadvantaged throughout this journey as well.
So I think we're going to wrap it up. If anybody has any more questions for our guests, please send them now. But before we leave, I do want to ask each of you a final message to those who are watching right now who, for whatever reason, are feeling isolated or depressed or anxious. June, let's start with you.
So I would just like to share with people that there is a lot of help out there. I can see in the chat that there are websites, there's lots of information to where you can get help. And just know that you're not in this alone, that people are there to help you. I'm there. If anybody would like to reach me through the hospital, through Allison, I'd be more than happy to help someone. I know what it's like to go through a journey alone, and there's no reason for anyone to be alone today. So I'm here to help, and I hope people will reach out if they need it.
Thanks, June. Evelina, final note?
I really reflect what June said. Absolutely. You are not alone. All of us, like Jonathan mentioned, we are all experiencing so much uncertainty and changes. So if you're feeling like you're the only person experiencing these difficulties, know that you're not, and know that you could talk to others and be vulnerable. And I know it takes courage to do that, but there's nothing wrong when we're over toxically stressed and we're having difficulty managing, to get some more support, take some things off our plate, ask for what we need, and search for things that are available, like the resources that are available. And it's okay to do that. And we all build resiliency and cope with things differently. So if you want to try just something new, please take a step today and reach out or talk to someone or check out the websites and resources that are available to you. Take the first step, and I wish you all the very best during this time. And thank you all for joining today.
Thank you. Jonathan, last word to you.
My last parting thought is that we all have to think about what our long-term strategy is. And that's why I like the concept of resilience, because this isn't about coping with something that's going to be resolved in a short time frame. We have to think about how can we be well and those around us be well in the face of this adversity over the coming months. And all of the things that we talked about and all of the resources that we talked about are tools that help you achieve that. But for me, and again, this came to me through this journey, it was given to me by a colleague, is one of the things that we can control is our mindset, how we think about ourselves and how we identify what we're in control of, what we can do to help ourselves and what we can do to help others. And if we adopt this thriver's mindset or a resiliency mindset, that we can get through this, that we can cope through this, that we're not looking for the light at the end of the tunnel, but we're going to go day by day, and understand what we can do within our direct control and what we can't, and focus on those. That to me has been what's helped me and what's helped us as a team, and I think what's helped the people that we're helping get through this. And don't delay.
Resiliency mindset and don't delay. I think that's a great note to end this conversation on. I want to remind everyone that we're back again next week, and next week we'll take a look at the role research is playing in helping us fight against and treat this virus. Our guest, Dr. Lisa Porter from the University of Windsor and WeSpark Health Institute, and Dr. Wasim Saad, Chief of Staff here at Windsor Regional, will answer your questions. Thank you to all of you who joined this conversation today. We do hope that you found some value in today's topic. Know that if you are feeling any of these feelings, you're not alone. I think that was a main message for today. And help is available if you do need to reach out. Again, we have included some information below that you can help connect with to get you the right information, get you to the right place. Some people have asked questions today that we didn't get a chance to answer, but we will try and answer as many as we can in the comments section below. Jonathan, Evelyn, June, thank you so much for being here with us today and for taking part in this important conversation. I hope everyone stays safe. Cheers.